what we're going to do is focus now on Reporting for Better Outcomes program. Now, of course, it has a slightly dull feel, but I want you to think of it as we're about to get a sophisticated and multi-directional update on a program that can improve our cancer system here in New South Wales, and that means survival, and that means quality of life if you're lucky enough, like I was, to survive. So it's actually full of human emotion and drama, but it's called Reporting for Better Outcomes program. And we've got 6 speakers, but don't be afraid, the longest presentation is 15 minutes, most are 10, and we've even got a couple of 5s. We've even got videos, and I'll intersperse it by whizzing around the room asking for your questions and comments. And I really welcome them, and absolutely don't hesitate to ask a question if you think it's too simple or obvious. You know, it's now the afternoon, we're the people committed enough to stay to the end. We could virtually take our clothes off and get on well together. So, I'd like to, so we're going to learn what is this Reporting for Better Outcomes program, how does it work, and how can we contribute to improving cancer services? So our first speaker is Professor David Currow, the Chief Executive of Cancer Institute New South Wales, the Chief Cancer Officer of New South Wales, effectively fearless leader. Please make him welcome.
Thanks very much, Julie, and thanks for the opportunity to introduce this afternoon. Reporting for Better Cancer Outcomes is in its 8th year, and it's really great to take the opportunity to reflect on what is being achieved through this program. This is about quality improvement, unashamedly. It is about service improvement, and although we collect data and analyse it, that process is entirely to drive systems improvement. So I pay tribute to Roo for this. It's not just a report. The report is one small part of sitting down with clinicians, funders, policymakers, the community, primary care, and really saying, what is it that we can do to make the most difference to cancer at this time? This is about people. It's about lots of individuals, and when you aggregate data, sometimes we worry that we lose the individual. Far from it. We're aware that this is the aggregation of literally thousands, tens of thousands of people's lives and experiences as we start to look at patterns of care and look at where we can make an influence that will genuinely change the future. Australia, together with Canada, is right at the top of the league table when you take data from our countries, pool it, and do a single analysis. You can see that for these 4 cancers, we're at the top of the league table. We have the second tranche of International Cancer Benchmarking Program data about to be released. 8 cancers, and again, we're doing incredibly well. So the question is, how do you make great outcomes from good outcomes? We've got good outcomes by any measure internationally, but how do we drive that to great? Well, firstly, we use data that, as we've discussed throughout the day and through yesterday's workshops, that are already there, and the ones that are in purple here are ones that we are already using in reporting for better cancer outcomes. The green ones are ones that we are starting to include, and clearly we've got patient-reported measures from our work with the Bureau of Health Information, but I hope that that will be point-of-care data collection in the very near future. The important thing is that for all of those pieces of the jigsaw puzzle, these are existing data. We're not asking clinicians to collect more data. We're not asking consumers to do anything other than at point of care give us some really crucial feedback. It's our ability to bring that together, to link those data into meaningful information, and from meaningful information into knowledge that can be applied in the system that makes the difference. So what's in the report? Firstly, an overview. Some population figures so that we put it in context of the state, but also that particular local health district, that particular primary health network, so that there is a context around it. We think about cancer prevention and how we can work together in that space. All of those lifestyle issues: tobacco, ultraviolet light, alcohol, exercise, diet, physical activity. What about cancer screening? We've got 3 national programs. We've got a long way to go for each of them. But our data helps to shine a light in areas where we can make a greater difference because we have invested in working with those communities in focusing our efforts. What about cancer treatment and service delivery? By looking at what we're doing across the state, we do see patterns emerge. And it's using those patterns and that insight that allows us to really refine some of the outcomes that we can achieve, not in 10 years' time, not in 5 years' time, but this year. And that's the really exciting part of that. This is not just about the next 20 years. It's about people drinking bubbles on New Year's Eve this year if we get it right. And finally, our involvement with clinical trials. Clinical trials not only for the people who are participating in them, but also the ability of clinical trials to lift the quality of care for everyone in that centre. Because clinicians are used to measuring their performance. Clinicians are used to being measured by others and getting feedback. Clinicians want to strive and excel in that space. So what is that evolution? We started small back in 2011 and we've grown in terms of the number of indicators. We've added in Medicare locals, we've added in statewide public reports. The number of indicators continues to grow. And as you can see, we've also added in the private sector consistently through that time. Importantly, over those years, we've also added in patient-reported measures. And that's a fantastic opportunity to hear the voice of patients. I do want to call out Mid-North Coast. They are doing a great job because they've been looking at point-of-care data collection for symptoms for several years now. And when you look at the data, they're ahead of the rest of the state as it comes to patients and their families reflecting on the care that they get. The public report was released this week. If you haven't seen it, please have a look on our website. I think it makes great reading, and I want to thank the media and communications team for translating really complex concepts into something that even I can understand. So with that, we are committed to ensuring that right across our community, we are looking at the spectrum of cancer control and ensuring that we're delivering better care this year than we were last year, with the commitment that next year's care will be even better again. So to hear from the team, let's look at what the Reporting for Better Cancer Outcomes team have to say.
Better Cancer Outcomes for the Cancer Institute is our tool to be able to engage multiple levels of the health system. It helps us to engage with chief executives, with executives across the local health districts, primary health networks, and participating private hospitals. It also helps us to engage with clinicians and all the levels of the health system.
And by providing data back to the health system, we're really able to show them their data so they can develop initiatives for improvement.
It brings together so much data, right from prevention, screening, treatment, clinical trials. It's a massive piece of work.
So our clinicians are actually involved right from the beginning in a lot of sections of our report because they give us advice on what is the data showing us. How can we turn the data into meaningful information that is relevant for the clinical setting and relevant for decision making?
The health professionals all want to do the very best for their patients, and providing them with real-time data that they can see their own performance against a suite of cancer prevention, screening, treatment and care empowers them.
We have a team of analysts that work on the data. We have a team of epidemiologists. We also have a team of people that have been clinicians themselves and teams of people that are experts in the health system and a lot of change managers and project officers. So it does bring a lot of skills together to be able to put this into one place. And I think that's one of the successful things about ROBCO is we actually harness that collective impact.
There's a drive and a purpose behind it. There's motivation for the Institute to actually deliver on it. It's not just a report that you hand out and that's the end of the story. There's things that continue on with it. There's things to follow up with how, like, what's been said and what gets done.
The main benefit of ROCCO or the program to the people of New South Wales is just that information is power, and just being able to use that to make informed choices when diagnosed with cancer.
Ladies and gentlemen, what we have just seen is a group of nerds. Thank God for them. I've never seen people so excited by data in my life. Would you please give them a round of applause? Now, I'd like to invite Roo. If you could take your spot, I'm going to do one thing, but if you could get into position, you'll note Roo is one of the nerds from the film. But David, could I just ask you a quick question, if you wouldn't mind leaping into the chat pit of fun? I just have to get on this side of you because of my right hand.
You need to redefine fun.
That's true. You know, I'm sure when you put up that square of what sources of data were already linked, and for those of you here this morning, remember there was a lot of discussion about the importance of data linkage, and then you had a few over on the side that were not linked. And was I right in seeing that cancer registries were not linked? And if that was right, why on earth not?
No.
What was the last one on the bottom?
I think you'll find it was the Pharmaceutical Benefit Scheme data, and
Clinical.
Could we just quickly go back to the big boxy one from David? If we just keep this one. See it there, clinical cancer registries.
So the population registries are part of this, and cancer's been a notifiable disease for 4 decades in New South Wales. We're adding another layer of data to that, which is the clinical cancer registry. And
So what are they?
So it's information from prescribing chemotherapy, prescribing radiotherapy, the surgery that was offered, and we're drawing that in, but we're drawing it from a number of sources. Part of that is the clinical cancer registry, and that will be a much more prominent part in years to come. But at the moment, we're getting those data. We've got the radiotherapy data. We're about to get some much more sophisticated feeds of chemotherapy prescribing.
And is that registry like one registry, or are there like regional registries or college-specific registries?
That's one across New South Wales.
Okay, thank you very much. Thank you.